Hello friends, now start with another topic, that is conscious sedation. In that it comes pharmacological behavioral management. So first we'll study the introduction of the pharmacological behavioral management. It is useful in children who are young, who have reduced mental capacity, intensely fearful, severe medical problems which affect their ability to cooperate. Once again, it is useful in children who are young, reduced mental capacity, intensely fearful, severe medical problems which affect their ability to cooperate. Useful in children who are young, reduced mental capacity, intensely fearful, severe medical problems which affect their ability to cooperate. So this I have taken from the textbook of McDonald's on the vital signs monitoring chart. Who can undergo the patients who can undergo the pharmacological behavioral management, there is a vital signs chart given in textbook of McDonald's. According to age wise it is classified. 1 to 3 years, heart rate should be 70 to 110 beats per minute. Blood pressure, systolic and diastolic. Systolic 90 to 105, diastolic 55 to 70. How I have remembered 105, it is ending with 5, and here again 55 to 70. Respiratory rate 20 to 30. Next age group is 3 to 6 years, heart rate minus 5 here, 65 and 110. 110 is same, 70 to 110, 65 to 110, plus 95 110, again 60 75, 20 25 is the respiratory rate. 6 to 12 years, 60 to 95, 100 to 110, 60 to 75. These 60 to 75 is same here. And 15 to 22. Age group 12 years, 55 to 85 heart rate, 110 to 135, 65 to 85 diastolic, and 14 to 22. Once again 1 to 3 years, 70 to 110, blood pressure systolic 90 to 110, 90 to 105, and 55 to 70, 20 to 30 respiratory rate. 3 to 6 years, 65 110, 95 to 110, 60 to 75, 20 to 25. 6 to 12 years, 60 to 95, 100 to 120, 60 to 75, 14 to 22. 12 years, 55 to 85, 110 to 135, 65 to 85, and 14 to 22. Okay. Next is the pre-anesthetic checkup, which is done before the doing the pharmacological behavioral management. So American Society of Anesthesiologists have given a classification that is known as ASA classification, again from the textbook of McDonald. They have classified patient 1 a normal healthy patient, patient 2 with a mild systemic disease, patient 3 with a severe systemic disease, patient 4 with a severe systemic disease who has a constant threat to life. Patient 5 is a moribund patient who is not expected to survive without operation. Now the sixth is the declared dead patient whose organs are to be removed for donor purposes. Okay. Patient with ASA 1, that is a normal healthy patient and a mild systemic disease, is considered safe for conscious sedation or the pharmacological management. Now coming on to the dietary instructions you have to give before the pharmacological behavioral management. It includes that patient should not take any milk or solid food midnight before the scheduled procedure. It is to avoid the emesis, because emesis is the vomiting which can cause regurgitation and airway obstruction which can lead to pneumonia. Okay, so what are the dietary instruction given? For 0 to 3 years patient, clear the liquid up to 4 hours before the procedure. For 3 to 6 years, clear the liquid up to 6 hours before the procedure. For more than 7 years, clear the liquid up to 8 hours before the procedure. Once again, 0 to 3, 4 hours, 3 to 6, 6 hours, 7, 8 hours. Okay, now coming on to the drug used in the pharmacological management. We have to study mainly about the route of administration, the group which is it is classified, and their side effects. So the group's route of administration can be inhalation, oral, intramuscular, and intravenous. Coming on to the inhalation, nitrous oxide, N2O, nitrous oxide inhalation. Oral, I have made it as Hey Prom Chale Dear. Hey से hydroxyzine, Prom promethazine, Chale chloral hydrate, Dear diazepam. So oral route, hydroxyzine, promethazine, chloral hydrate, and diazepam. Intramuscular, प्रॉम क्या मिडनाइट है, प्रॉम क्या मिडनाइट है, पी से प्रोमिथाजीन, क्या से किटामिन, मिडनाइट मिडाजोलम है हाइड्रोक्सीजाइन, इंट्रावीनस मिडनाइट डियर, मिडाजोलम diazepam. Okay, this is I have made a mnemonic to memorize. It's up to you. You can make any other of your choice. Okay, so next is the coming on to the root drugs. It is classified the drugs, their side effects and their doses. Antihistamines. The first group is the antihistamine. The first drug is hydroxyzine. Their side effect is drowsiness, dry mouth and hypersensitivity. Doses: oral route 1 to 2 mg per kg, for intramuscular 1.1 mg per kg. Okay, 1 to 2 mg per kg oral, intramuscular 1.1 mg per kg. Promethazine. Side effects are dry mouth, blurred vision, thickening of the bronchial secretion. Oral or intramuscular both have the same dosage, that is 0.5 to 1.1 mg per kg. Okay, 0.5 to 1.1 mg per kg. Next is the benzodiazepines. It includes the diazepam. Side effects are ataxia and prolonged CNS depression. Dosage for oral route 0.2 से 0.5 mg per kg, for intravenous 0.25 mg per kg. Next is the midazolam, causes respiratory depression. Reversal agent includes the flumazenil. Intravenously it is given. Dosage for oral 0.25 to 1 mg per kg, intramuscular 0.1 to 0.15 mg per kg, and intravenous according to the manufacturer's guideline. Next is sedative hypnotics, includes chloral hydrate. Oral route say 25 to 50 mg per kg, and maximum dose orally you can give is up to 1 gram. Okay. General anesthesia is a complex procedure, as you must have seen, and it is expensive as well. There is a behavioral management spectrum given. I have taken from the article of Christopher C. et al. 2022 from the Pediatric Dental Journal, and it has shown the first approach should be the non-pharmacological behavioral management for the child. The next, it should under local anesthesia, then the relative analgesia, then the intravenous sedation, and lastly we should prefer the general anesthesia. Now coming on, when are general anesthesia indicated? When the patient cannot cooperate due to lack of psychological or emotional maturity, when LA is not effective due to infection or allergy, etc. Extremely anxious or uncooperative patient, when the patient requires an immediate treatment or comprehensive dental care due to trauma, infection, cellulitis, acute pain, etc. Contraindication: when a patient is healthy and can cooperate, young patient with minimal dental procedures, predisposing systemic conditions. Okay, so this finishes our general anesthesia and the general anesthesia, pharmacological behavioral management का general anesthesia. Again I'll repeat till here. It is introduction. It is useful in children who are very young, have reduced mental capacity, intensely fearful, and with severe medical problems which affect their ability to cooperate. Vital signs monitoring: age 1 to 3, 3 to 6, 6 to 12 and 12 years, 70 to 110, 65 to 110, 60 to 95, 55 to 85. These are the blood pressure, respiratory rate. Next is the pre-anesthetic checkup, that is PAC. American Society of Anesthesiologists have given classification. Dietary instruction: according to age wise it is classified. Then drugs used in pharmacological management, route of drug administration, the drugs, the route of the classification of the group, the drugs, and the their dosages. Now this is the behavioral management spectrum, indications, contraindications of GA. Now we'll start with our next drug, that is the nitrous oxide sedation. It is also very important. It was introduced by Horace Wells. It is considered one of the safest drug for sedation because of its low solubility in blood. So thus it has got a rapid onset of action and rapid recovery rate, 2 to 3 minutes usually. It causes minor depression in the cardiac output. So cardiac output is decreased. But what happens? The peripheral resistance increases. Therefore, the blood pressure is maintained. So it has got an advantage for treating in patient with serious disorders, cardiovascular system disorders. Now, what are our objectives to treat the patient under nitrous oxide? To reduce or eliminate anxiety, reduce untoward movement and reaction to dental treatment, enhance communication and patient cooperation, increase pain threshold, increase tolerance for longer appointments, reduce gag, and potentiate the effect of sedatives. Now, what are the disadvantages? It is a lack of potency, that is because of rapid recovery and rate, dependent largely on psychological reassurance, interference of the nasal hood with the injection to anterior maxillary region. Patient should be able to breathe through nose throughout the process. Should associated with bioenvironment concerns due to contribution to greenhouse effect, as given by the Yasny J et al. 2012 in environmental implications of anesthetic gases. Now, coming on to the recommendation given by AAPD 2022, use of nitrous oxide in pediatric patient. They have recommended that patient should be reviewed for any drug allergy or previous allergic reactions. Patient current medication should be recorded. Any other systemic condition, previous hospitalization, the date and the purpose should be recorded, and recent illness that may compromise the airway and compromise the treatment process. Contraindication: chronic obstructive pulmonary disease patient, the patient with middle ear infection, severe emotional disturbance, treatment with bleomycin sulfate or methylene tetrahydrofolate reductase, or with cobalamin, that is B12 deficiency. Now, what is the technique? How do we use it? Thoroughly assess the equipment first. Selection of the appropriate nasal hood should be different sizes of nasal hood are present. Flow rate, usually 5 to 6 liter per minute is mostly accepted. Adjust the flow rate by observing the reservoir back. It should neither be too much under or over inflated. Okay. Introduction of 100% oxygen for 1 to 2 minutes. Then titration of the nitrous oxide at the 10% interval is recommended. The concentration of N2O should never be increased above 50%. To achieve sedation, make sure that the patient is breathing through the nose. Scavenging system should not be strong, that it prevents the adequate ventilation of the lungs with nitrous oxide. According to Malamed et al. 2003, a new look to a old technique demonstrated that typical patient requires 30 to 40% of nitrous oxide to achieve ideal sedation. Studies have also reported that nitrous oxide sedation was of no benefit once the profound anesthesia is achieved. Now, continue behavior guidance technique during the treatment, as it depends, as this procedure is too much dependent upon the psychological assurance. Now, once the nitrous oxide is terminated, 100% oxygen should be administered until the patient returns to the pre-treatment status. What are the adverse effects? It has been reported that 0.5 to 1% of the patient have reported nausea and vomiting. This was due to fluctuation of nitrous oxide levels, lack of proper titration method, or increased N2O concentration or heavy meal prior to the treatment. Another adverse reaction was diffusion hypoxia, that is rapid release of nitrous oxide from bloodstream into the alveoli. This can be prevented with 100% of oxygen once N2O flow is terminated. Now, coming on to the documentation. Before starting the procedure, informed consent from the parent should be taken. Record the vital sign of the patient before the procedure and give the dietary instruction also should be written. Monitor vitals during the procedure. Duration of the procedure, post-treatment oxygenation procedure should also be recorded. Now, coming on to the equipment. Newly installed facilities to deliver nitrous oxide should be taken. Thoroughly check for the proper gas delivery and fail-safe function prior to use. Check reservoir bag for any crack, tear, leak, etc. Training and certification for basic life support should be basic life support should all the should sorry the clinician should have the training and certificate for basic life support. An emergency kit readily accessible should be there, which includes the equipment which can resuscitate a normal non-breathing unconscious patient and provide continuous support until the trained emergency personnel arrives. A positive oxygen pressure, that is 90% of oxygen for 10 liter per minute flow for 60 minutes must be available. These are the cylinders. For oxygen cylinder, here it will be of white coat, and for nitrous oxide cylinder there will be a blue marcation here. Okay, now occupational safety. Chronic exposure to nitrous oxide studies have shown that results in bone marrow suppression, reduced reproductive system suppression. Causes reproductive system suppression. Therefore, effective scavenging system should be present. Now coming on to the various studies, recent studies and their conclusion. AAPD recommends exposure to ambient nitrous oxide should be minimized through the effective scavenging system, minimal patient talking and mouth breathing during the procedure. Yasny J et al. 2012 has reported that nitrous oxide adds to greenhouse effect. Dental treatment under relative analgesia and local anesthesia is an effective way for mild to moderate anxious pediatric patients. When relative analgesia is not successful, other methods should be considered on the basis of the behavioral management spectrum. Age-effective intravenous sedation can be an effective general anesthesia alternative. These were taken from the article Laraga. LA is local anesthesia, relative anesthesia, general anesthesia, pharmacological behavioral management in pediatric dentistry in UK by Christopher C. et al. 2022, Pediatric Dental Journal. So here we conclude. If you have any doubt and questions, you can post it in the comment section. I'll be happy to help. I hope it was informative. Thank you.